So my name is Dr. Rohan Kulkarni. I'm one of the vascular surgeons here at Vegas Vascular Specialists. One of the hallmarks of vascular disease and what we treat most frequently, I'd say, as vascular surgeons is something known as PAD, otherwise called Peripheral Arterial Disease. It's a disease that is related to the progression of atherosclerosis or hardening of the arteries. The same way that people can develop heart attacks or hardening of the arteries in the heart, it can also happen across all the vascular trees throughout your body. This can include the blood vessels going to your intestines and most commonly the blood vessels that go to your legs. One of the hallmarks, one of the symptoms of PAD that people experience most commonly is something called claudication. This is when you develop muscle pain or muscle cramping with walking. And the reason this occurs is as you begin to develop hardening of your arteries and the blood vessels narrow, when you walk, the muscles of your leg are asking for more blood flow and more nutrition, which they cannot get when the blood vessels are blocked. One of the most common symptoms associated with PAD is muscle cramping with walking. This is known as claudication, and this occurs because the blood vessels that feed the muscles of the leg, as they become more narrow and less blood flow can get to your muscles, you develop cramping, pain that occurs with walking. This can progress to wounds on your feet that do not heal, or ulcers, and even further along the disease progression, you can actually develop pain in your legs that is at rest. So just sitting in a chair, you'll be in severe pain. So this is one of the diseases that we really do treat most commonly as vascular surgeons. The way in which this disease is treated has sort of been revolutionized over the last 10 years. What used to be done as large open surgeries requiring several days to weeks even in the hospital can now be done on an outpatient basis, minimally invasive, using wires and catheters, otherwise known as endovascular procedures. So when we do these procedures, we often do them in the cath lab or a radiology suite as opposed to the operating room. And what we're able to do is by putting in a large IV, we can actually do the repair, minimally invasive, wires and catheters, balloons and stents, and sometimes even have you out the same day. The nice thing about vascular surgery and what we do that is very unique compared to any other type of surgery or specialist is we're able to offer you the full spectrum of treatment. Whether it be minimally invasive surgery or large open bypasses, we want to do the right operation for the right person at the right time. So what is really unique about vascular surgery is that we can offer you the full spectrum of operations and procedures. For some people, the minimally invasive surgery is the right one. For some people, you need to have the large open bypass. We always want to do what is going to be right for the person, the right patient, and the right operation. So that is something that we really pride ourselves on as vascular surgeons, being able to do the right thing and the right surgery at the right time. If you would be interested in learning more about PAD or PAD treatment, please visit our website, and we're always taking new appointments, and you can call and schedule on the website anytime.